Hi, my name is Dr. Kishan Patel, and I'm a postdoctoral research fellow working at the MRC Unit for Lifelong Health and Aging at UCL. Last year, I joined a team of researchers working on the National Core Studies Longitudinal Health and Wellbeing program. The aim of this program is to understand the health, social, and economic impacts of the COVID-19 pandemic by analysing established population cohorts as well as national electronic healthcare records in order to guide implementation of and changes to government policies. One of the studies I worked on as part of the National Core Studies programme looks at how the mental health of the UK population has evolved across the COVID-19 pandemic. We were interested in how mental health changed since before the pandemic, how experiences of mental health varied under different lockdown measures, and how the pandemic impacted already existing mental health inequalities. In order to address these questions, we conducted a coordinated analysis of data from 11 longitudinal population-based studies. The prevalence of poor mental health was assessed using measures of psychological distress within each study at 4 different time periods: pre-pandemic, during the first lockdown in spring 2020, during easing of lockdown restrictions in summer 2020, and then during a subsequent lockdown at the end of 2020 and start of 2021. These results were then pooled using meta-analysis techniques. Overall, almost 50,000 adult participants were analysed. So what we found was that overall, UK mental health deteriorated across the 3 pandemic time periods, as high psychological distress increased. But not everyone was affected equally. The results highlight widening inequalities in mental health. Increases in psychological distress were higher amongst females than males, and changes in psychological distress were higher for those who were degree-level educated. We also found that increase in distress was most prominent amongst adults aged between 35 to 44 compared to other age groups. We found no evidence of change in distress differing by ethnicity or UK nation. And what this means is that population health has been persistently worse than before the pandemic. Importantly, our data does not indicate a bounce back in mental health with the easing of restrictions in summer 2020. This suggests that avoiding lockdown measures alone may not maintain population mental health, and that other factors affected mental health during the pandemic, such as the stress related to uncertainty, illness, and loss of income. The pandemic also highlighted the limited ability of health services to meet mental health needs during periods of high stress. To minimise the detrimental longer-term consequences of the pandemic, mental health care needs to encompass multiple levels of support, including investment in primary care, community mental health, and public mental health, and wider measures that support population mental health. Initiatives should also target specific groups at greater risk of experiencing mental health. Thank you for watching. You can read the paper in full, published now in JAMA Network Open.